what we could anticipate coming down the pipeline in that regard.
Yeah, sure. Thanks, Nate. So for routine healthcare procedures, we particularly look at certain groups. So, if you called up to the hospital recently and asked to schedule like a well visit, you may have been asked if you want to do that and how, if you want to wait a couple months. So for routine things that can wait, we are encouraging you to consider waiting up to a month or two if you feel like you can and if you want to. Particularly if you have a lot of, if you're concerned about being high risk for coronavirus, just in general, getting out in the community and that sort of thing. We do have the clinic still divided well and sick sides. So I think we are trying to do everything we can to, when we see those who are there for a non-respiratory illness, we're trying to separate those people, and I think that helps. But in particular with children, we get that question a lot with what do we do for well child care, and especially if they need vaccines. The American Academy of Pediatrics has spoken directly to this, and they still recommend prioritizing visits for those under the age of 2. So newborn to 2, especially because that's when they're getting their primary vaccine series. We definitely want to still see those kids and give them their vaccines so that they don't get off schedule. So, but in general, we are still seeing patients, and so if you're not sure, you can always call.
Perfect. And I think as we go through any of these, I think sitting in the dark and wondering is probably the worst thing anybody can do. Always take the time to reach out to providers or other professionals and ask those questions. So thank you. Next question. It seems like a lot of us have probably heard about what was a breakout up north in Callaway. So not very far away. It seems like they had several instances of positive COVID tests. Could you just speak to that a little bit, Dr. Dalrymple?
Yeah, so what I know is similar to what has been released from the Public Health Department, in Loop Basin Health Department. So my understanding is that there have been 9 cases associated with the Callaway Good Life Center. It's a long-term care facility. It sounds like it was 1 staff member and 8 residents, and I believe that those residents, or all of those people, were removed from the facility. They did some extra cleaning measures to really try to keep the facility and the other patients safe. And so that's really what we know. Loop Basin District they had 2 deaths, and I don't know if those are associated with the Callaway nursing home or not. I think it's a good time to just talk about how important it is to keep our higher risk residents that are in long-term care facilities and assisted living facilities safe. There's been a lot of, I watched a news segment recently, and I think they said it best, it's a perfect storm. So it's people who are at very high risk of infection and very high risk of severe infection, and they live close together. And you have staff who, we can do as good of a job as we can staying clean, washing our hands, but they're still seeing multiple patients, at a facility. So we just want to avoid having the coronavirus in our long-term care facilities as much as possible. And I think they've done a really good job here in our community. They've been very strict about visitors and people coming and going. And I think that's important. That's essential. So.
Great. Yep. Thank you. Appreciate that. And even Scott Barr, the administrator at our local Hilltop, when he first logged on, I saw he was wearing a mask. So I do appreciate taking those precautions, and that isn't anything we take lightly. Kind of a transition question, or I guess a good follow-up question to that, Dr. Dalrymple. For those employers that still do have employees that are needing to come to work, kind of those essential people, what would be some best practices to ensure the safety not only of those going to work, but those that are interacting with the public while they're at work?
Mm-hmm. Sure. So for like going to the grocery store and places like that, I think that it comes down to what we say every week, and it's never a bad idea to go over that again. So wearing a mask in public, that became a big news piece a week or so ago, and I can't emphasize that enough. So whether it's a homemade mask or some kind of facial covering, they really want to emphasize doing that. And again, that's for protecting others from you, believe it or not. It's protecting others from if you're coughing, sneezing, or have any of that virus in your nose or in your mouth. So, so wearing a facial covering or a mask is going to be good. Washing your hands regularly, before and after going places. And then that social distancing, it's kind of hard to look at what 6 feet is, but it's been great because certain places in our community have actually taped out 6-foot intervals in like the grocery store lines and things like that. And that's not something that we're used to doing, is trying to stay that far apart from people. But I think, starting to really look at that when you're in public and just avoiding that distance really does help minimize the spread. And the other thing I think that is worth bringing up is if you can do it, shop alone. So like if you're going to the grocery store, don't bring your whole family. And that's for your own family safety as well as everyone there. If you can do it. I know that not everybody can, but if there's a way that just one person can go shopping once a week, that's the ideal thing. And if you're sick, stay home. And if you can at all possible, have somebody else, delegate those things for that person.
Great. You talked a little bit about wearing a mask, and for me, I have the woodworking mask that I would have had in my garage because I like to mess around in the garage every once in a while. And then maybe a different example like this, it's maybe a more customized to the current situation, or even there's homemade masks that are becoming more and more popular. Can you give us just a little bit of mask etiquette, or the how to properly mask?
Yeah, so before there were limitations in personal protective equipment, we used a mask once with one patient encounter and then we threw it away. So it's amazing thinking about that right now. And there's been so much information and research at big universities and other places about how to reuse masks in a safe manner. I think it's important to distinguish between surgical masks and masks like N95 respirators that we use in the hospital versus home sewn masks and facial coverings. So if you're looking at a mask that's from the hospital, like the ones that you have there, Nate, like a N95 respirator, and I don't have all these, I should have grabbed some before, sorry. But, and ideally, so wash your hands before you put them on. Again, you're going to be touching your face, putting that mask on. So that goes back to everything we said before, avoid touching your face. So if you're going to wash your hands first. I always say try not to touch the actual mask on the front or on the back side. I think that's ideal. Just touch where you're going to be putting it over your ears or tying in the back. So again, I talked about how we used to just use it once and then that was it. But so now some of the things that we try to do in terms of reusing those is we'll put them in like a brown paper bag, or have some kind of way that they can get air to them and allow that if there's any viruses or anything to die on that mask. But for most people at home, I think the facial coverings and fabric masks are what people have. So same thing applies, washing your hands before you take it off or before you put it on. And then washing those regularly in hot water. So in the washing machine with hot water, I think is going to be the best thing to do. I think those are the main points I would make about wearing a mask. So
perfect. Okay. I've got 2 more questions for you. Okay. One's really easy and one's tough. Which one do you want first?
Oh, let's go with the easy one first.
Okay. What should someone do in case of a dental emergency? I know you're not a dentist, but I think you probably have the answer to this one.
Well, sure. So, and I actually did reach out to Dr. Audrey Aiden, one of the dentists in our community, and talked with her. And I'm glad she did because she gave me some good information. So she said, yes, they are taking patients that have urgent or emergent needs. So things like infections, pain, that sort of thing, swelling. She told me that her cell phone number is on the door at her office. It's on a piece of paper there, as well as on their answering machine. So if you have an urgent need, she encouraged you to reach out. And I'm fairly certain, I've heard this in the past, that our other dentists in town are doing the same thing. So if you have an urgent dental need, absolutely reach out to them, and they will be happy to help you.
Great. And this next one I could pose to you, but I'll probably ask Katie Mulligan with Two Rivers also. But how long is this going to last? How long are we going to be in this new sense of reality? Yeah, that's the tough question.
That is a tough question. I wish I had a great answer for that. I don't think anybody knows. I think that there's some important considerations to think about when we're talking about how long this is going to last. We have to think about how we can re-enter society without everybody getting sick. Anytime that we start opening things up the way that they are now, people will get sick, and that's going to increase. So I think there's 3 areas to consider. One is a vaccine is going to help a lot, and I know that they are very actively working on that. But the timeline, if you look and you research that at all, it's 12 to 18 months. I don't know about you guys, but I don't know if I can not get a haircut for 12 to 18 months. So I think we're going to have to find a way to get back to some kind of normalcy. But so that is definitely, I think that's an endpoint that's going to be really important to really getting back to normal, is a vaccine. The other thing is that people build up some immunity after they get it, and that will likely take longer, is what my understanding would be. If people have this, enough people start to get it, they build up some natural immunity to it, but that likely will take longer. I think the other piece of this is trying to get some more widespread testing so that we have a better idea of how it spreads and who has it, even if they're asymptomatic, and also how it affects certain people. So there's really no great answer. I think in general, the thought process here in the United States is that April, May, there's going to be quite a bit, and we'll talk about that later here in Nebraska, likely going to be kind of a lull in June, July, and then may or may not be another peak later. But, you know, hopefully we'll see some return to normalcy, and of course opening up some businesses soon. But unfortunately, I don't think it's next week.
Thank you. Appreciate it. Okay. And one of the things I was going to tell everyone at the beginning, but I will share now, we did have a number of questions submitted ahead of time, and we are going to try to work through those. As we go through the meeting today, if you would like to submit a question, please email Deb at deb@growgothenburg.com. Or no, we'll put it up. We'll get it in the chat menu, what Deb's email address is. And go ahead and email her. And if we can get to those questions, she'll get those in the queue here to us, and we'll address those if we're able to. So with that, gonna have some questions for Mick. Mick, I had a question submitted. What is the hospital's capacity?
All right, thanks, Nate. Our typical capacity is 12 beds. That's what we're licensed for. But with the COVID situation, CMS has sort of waived the licensing requirements. So we could actually, as many beds as we could get our hands on, or wherever we could fit them. We think that we can reasonably accommodate about 32 beds, so like another 20 beds. We also have an arrangement in place with 2 of our tertiary care hospitals, our neighboring facilities, one to the east and one to the west, where we could potentially take their non-COVID patients and they would take our COVID patients. That way, sort of really protects the patients and keeps the ones that have COVID separate from the ones that are maybe in the hospital for something else. So we kind of have 2 contingency plans. One of them is just increase our beds, and we have staffing planned for being able to do that. And the second is to be able to really rely on those tertiary care facilities.
Perfect. Good. That's great. And so that kind of leads into the next question what is our backup plan? And it sounds like the first game plan is really kind of what the backup plan is too.
Yeah. So we started, when we started sort of our disaster planning for this, we were really looking at how can we fit as many beds as possible into our our 4 walls, if you will. So that's kind of where we came up with the sort of the 32 number. And we would put them in surgery areas. We would go from private rooms to semi-private rooms, just kind of putting beds where it makes sense, where patients can be safe. But later on, just a couple of weeks ago, actually, the 2 tertiary care facilities approached kind of all the critical access hospitals in the region, or that they work with, they partner with, and asked if they would be willing to take on their just medical cases, and in return they would take our COVID cases. To my understanding, at that time, and this is to our credit to our medical staff, Dr. Dalrymple and the rest of the team, when I asked them that question, they did not hesitate to say, yeah, well, absolutely, we're a hospital, we'll take whatever kind of cases that they can send to us, given that, we can't take ICU patients and we've got to be able to, have the facility to take care of them. What I was told by both tertiary care centers is that we were the only hospital that really stepped up to the plate and said that we would be willing to do that. The other ones all said, we'll take your swing bed patients, and that's, patients that are kind of a step down kind of thing, but we really aren't, our medical staff's not prepared to take on your sicker patients. And so I was really, really happy with our medical staff and just the willingness to partner and to make that as an alternative backup plan. So really, we've got sort of, like I say, 2 plans in place.
Great. Appreciate it, Mick. And for anybody that does have the ability to open up the chat window, Deb's correct email is listed in there now. So thank you for that. Mick, a couple more questions for you. I thought this is an interesting question. Is there any funding tied to when a community gets a positive test for COVID?
Yeah, so it doesn't necessarily apply to us because the way that we get reimbursed based upon our cost of providing care. But for the hospitals that get paid based upon a diagnosis code, and that's those tertiary care hospitals, they're getting a 20% increase for their normal diagnosis for taking care of COVID patients. So they know, there's higher risk. They know that those hospitals aren't excited. It's going to take more resources, and so they're getting they will get a payment bump. It doesn't really impact us because of the way we get paid is very different than the way, say, Great Plains gets paid or Good Samaritan gets paid. So those big hospitals they do get a bump in pay, but the critical access hospitals, just by the nature of the way we get paid, there's not specifically. Now there are other stimulus aspects for us. One of those being that because of some of the stimulus stuff, the sequestration has been taken away for so that 2% reduction in Medicare payments has been eliminated through December. So we would get a bump that way, but that's not necessarily specific to taking care of COVID patients. It's just really because of the pandemic.
Great, thank you. In your opinion, do you think that's having an impact on how the medical community is implementing testing or deciding when to test or when not to test?
I don't really think so. I think that the real limitation in testing is the availability of the tests. There's also a question with regards to sort of the accuracy of the tests, and those numbers kind of range quite a bit. But depending upon the lab and places like that, we're hearing as high as 30% false negatives. So what that means is that 30% of the patients that are getting tested, that come back negative could potentially still be positive. So the testing is not very accurate and the availability of the tests is really, really low. We've done roughly 40 tests in our hospital, and we get some minor replenishment kind of on a weekly basis, but on any given day we have maybe 10 to 15 tests even available to do. And that's being addressed in some ways by the National Guard setting up mobile testing places, and I know that as being part of some of the Two Rivers conversations, I know that they were working on some of that happening in Kearney, some of the larger population areas. I know it's happened in other parts of the country, but I haven't really heard of it coming to the smaller communities at this point. So it's really the testing is limited by just how many tests are available, the swabs, the reagents, just the ability to do the tests. And so our providers are pretty cautious about using the tests because they don't want to waste them. What they are more likely to do is to make the diagnosis based upon the symptoms that the patient has, and they don't necessarily have the test back it up, but the treatment is the same, and they can order a quarantine based upon having the symptoms without having a positive test. And so that's kind of a part of the strategy that I know that our providers have used, just that kind of hold on to those tests for those that are maybe critically ill, people coming into the emergency room, maybe inpatients, maybe healthcare workers that have been exposed, or we think that they've been exposed. We're holding on to those tests for various reasons, just because there's such limited availability of them.
Great. Thank you, Mick. Good. And yeah, speaking of testing, I think it'd be good to direct some questions towards Katie now. We have Katie with us today from Two Rivers. Thanks for taking time to be with us. A question that we've gotten a couple different ways is that it appears Two Rivers is now taking the approach of identifying positive tests by county versus naming those by town. And just wondered if you could share some insights with us on maybe why you've chosen to do that, or if there's a potential to get the by town information.
Thanks for asking. I do want to clarify, we never did report by town, which is a great question, and I can tell you why we don't, and it's to protect community members. We don't want individuals who are positive to be targeted in any way, and we were even, like at the beginning, we were a little bit uncomfortable releasing information by county levels because some of our counties have fewer than 3,000 people in them anyway. So it's kind of tough, you know, we all know how effective the rumor mill is in all of our counties, and we want to protect that individual information and be sure people are able to heal and work through this in peace. So we have been releasing information at the county level, but no lower than that.
Good. And I think Dr. Dalrymple would have given us from the onset of this deal is treat other people as if they have it and take those best precautionary measures at all times. And that's really is a best practice regardless of how many cases are or are not officially identified in an area. So great. If Gothenburg started to see, or Dawson County started to see more cases, do you think that would lead to more stringent recommendations for people to wear masks? Do you think we're going to be seeing more masks in the future?
I think we should probably start seeing more masks now, and we can talk to our health leaders on this. I know Amber and Dr. Dalrymple and Mick probably have some opinions. I was just going through the numbers for Dawson County in total, and they've been increasing by 2 or 3 each day this week. So we're looking at quite a few new cases in Dawson County. Right now we're at 17 overall, but that's been kind of a dramatic week for Dawson County. I think last week we had 3. So it's probably a good time to start wearing the masks now and follow all those instructions Dr. Dalrymple gave. They were great instructions.
Great. Another tough question. Some of our panelists get some really tough questions, so I'm going to feel comfortable giving you a tough one. Any thoughts on when our number of cases in Gothenburg or in Dawson County would likely peak?
This is my personal opinion, but we're headed toward a peak, and we're headed toward a rapid increase really soon. We expect to see quite a few new cases in Dawson County even starting this weekend. I'm not saying it's going to peak, but we do know that it's going to increase very quickly, very soon. And then like Dr. Dalrymple said, it's hard to predict. We've never seen what this is like, and we don't know how to, or we do know how to decrease it, and it's definitely been like a public health practice, and we've been preaching stay at home for the last 50 years when you're sick. But we also know that there's a lot of good work ethic in our Nebraska towns and in our community, and we know that a lot of people think, well, this is just a little cold, I'm going to go to work. So really the best thing that we can do is stay home when we're sick and hope that this really quick increase that's going to come up really soon is really attended to by everyone social distancing, wearing those masks, all of those measures that need to be taken.
Great. Thank you. For those of you that may not have been able to see Dr. Dalrymple while Katie was talking, there was a lot of aggressive head nodding up and down occurring, and certainly consensus, I would say, from our medical community here. So a good positive acknowledgement of the information coming from Two Rivers. Thank you. A couple more questions for you. How will we know when the curve is flattened here, and when will it be okay to reopen our businesses?
We're going to keep looking at that. We have those directed health measures through ourselves and Governor Ricketts, And every few weeks, we're reassessing those directed health measures and talking about, do we need to extend these? Do we need to lighten these? And we're thinking, looking at early May and June, we get to start maybe returning to life a little bit like normal, but we're really not sure. And we have had discussions on a local level of, do we need to open swimming pools? Is that a good idea? Should we follow through with graduation, or should we do virtual graduation? Those kinds of discussions, and we're still thinking about it. We're hoping at least, sometime this summer we at least get to have a barbecue or a block party, but we'll see.
Yeah, perfect. And so you'll get the first question that's come in through Deb Eggenberger's email. So an unscripted question, but it's very similar to what you were talking about. Any advice on, say, like summer Bible camps or some of those kids activities or different activities? I think that's what you were just kind of alluding to in your final comments, but.
Right. For right now, we're not really super excited about them. We really do want to keep social distancing. We might have to have Bible camp on Zoom, which is pretty depressing for everybody, I know, but it's going to keep everyone safe. And we're not, like the directed health measures say, we're not really emphasizing any group activities. We don't want people to participate in any group sports until at least June 1st, maybe longer. And we really are, we're not sure when this is going to end, or, if it'll continue during the summer or not.
Great. Yeah. Thank you. Appreciate it. We're going to now transition some of our questions to Dr. McConnell. As I said earlier, Dr. McConnell is a psychologist with Behavior Medicine and Associates. When we were talking about potentially having him participate in this, he said, well, a lot of therapists may choose to participate in something like this to maybe increase their call load or their patient load. But it was really neat. I think something that I know I certainly appreciate about Dr. McConnell. He said he's full. He's not actively taking new patients, and he's still willing to take the time to share some information and insights with us. So thank you for that. The first question for you, Dr. McConnell, would be, how should I talk to my kids about COVID? What's an appropriate level of communication for them?
Yeah, so, kids is a pretty broad term. So a kid can represent someone who's 5 and someone who's 17 or 18. And so one of the things that I just encourage people is, when we talk to children, just think about where they are developmentally and what they can understand. And I think the biggest thing is to think about, if I could liken it to like the birds and the bees talk, what we might do to answer those questions for a 5-year-old is much different than I would for a 17-year-old. So the best way to go is simply just giving developmental facts that are appropriate, what we do know as opposed to what we don't know. And then be careful about talking too much about it. So I think it's one thing to provide information, and then it's the other thing to regurgitate that information on a frequent basis. Generally, when kids are curious, they'll usually come to you with questions. So at times, we may feel more anxiety than the kids. So we have to be careful about how often we're bringing it up to them. But generally speaking, answer their questions, give them the opportunity to tell you what they've heard or what they've heard from friends or other teachers. And then at that point, just try to offer any, the information that you do know you can provide them, depending on their age group at that time.
Appreciate it. Good. As far as kids and adults, who do you think's getting through this rapid change that we've experienced more gracefully?
Well, I don't know as far as who's more graceful about it, but I will say, since it's happened, I've had more calls from parents than I have students or teenagers. And if you think about that, that makes sense. Generally, we have adults that are much more knowledgeable about the overall impacts, whether on their financial well-being, the ability to have employment and stability in their lives. So when it first started, one of my concerns was actually parents and the increase of the parenting demand, child care, the cost of it. And so far, that's playing out here in this first month. Most of the calls that are coming are from adults that are actually struggling, and their anxiety is much more higher than most of the kids that I've seen recently.
Yeah. What about social interactions that adults typically have versus what kids typically have? It seems like kids maybe are more plugged into staying in touch in a virtual way than adults.
Yeah, this is what we've been getting on kids here for the last couple of years with all their social media. But if you look at it, most of your younger kids and some of your adolescent boys, they're staying in quite a bit of contact through video gaming. I mean, most of the video games they're playing actually are doing it with their friends. And the same with what we're seeing through Instagram and Snapchat. So a lot of our kids are maintaining contact. It's just not the face-to-face contact. And what I'm seeing is us adults are much more in need of the physical face-to-face contact. So our kids are weathering it fairly well.
Yep, good. I had a question about people you talked about adults and some of the adult issues that people would be dealing with, and how that leads to maybe feelings of anxiety or insomnia, or, you know, maybe a sense of being overwhelmed. Is that something you can speak to or give us some pointers on?
Yeah. So one of the questions that comes up is just anxiety of adults in general. And what I would say is it's okay to be anxious, and you should be anxious. If you look at the change that has happened here in the last month to 2 months, if you're not anxious, you probably don't have a pulse. So I think one is just to give ourselves a little bit of grace that it's okay to have feelings and emotions, and anxiety should be one of those things. I think when you're looking at the ones that kind of creep up on you that you probably need to watch is the ones that start to affect your overall performance, whether that's in your relationships, your job, your family relationships. And so look at how you keep a normal routine. And when you start seeing that change, whether your production at work, your irritability, those are probably the anxiety components that you really want to take a look at, that it's probably creeping up on you without you completely noticing it. And so those are the ones you probably want to be aware of. If it's getting to the point where it's affecting you, one is get back to the normal routine that you had before all this, as much as you can, as far as your bedtime schedule, what you eat, what you drink, those types of things. And then if it gets to the level where it's overwhelming and completely bombarding you, then at that point, you probably should reach out to a healthcare professional at that point.
Yep, great, appreciate it. Another question that came in, I found myself getting angry with friends when they don't take the threat seriously. They think of a quick visit, that they're fine. You know, any pointers on how we can communicate the gravity of this to maybe some of the people that aren't taking it as seriously as what they probably could?
Sure. Well, I hope we don't all lose our friends through this. But the other part is just to keep in mind that through any changes or times, everybody is at a different pendulum or spectrum. And so you're going to have some people that are extremely vigilant, very anxious about it, and you're going to have some very laissez-faire, passive people about it. And so one thing is just to be very, very tolerant of people and their different approaches, how they see problems, and you know, I'll give you an example. I had a brother that called me and thought this, you know, was all a big to-do about nothing, until all of a sudden a case came up at his workplace, and then all of a sudden he took it pretty serious. And so you have to give everybody a chance to kind of grow in their development of it. But at the same time, I do think you have to have enough of a backbone at times to stand your ground if you do need to, but be very kind about doing so. So if someone was going to feed you raw chicken, you wouldn't eat it. The same is the case when it comes to this, meaning do it loving and with kindness, but at the same time, there are times where you're going to have to put a firm boundary up there and not apologize about it.
Great, thank you, appreciate that. That's great advice. I know when I interact with different people, I can pick up on some of their different personality traits, and I'm sure you see that in your day-to-day quite a bit. Are there different personalities or personality traits that are maybe having a better solitary experience, or maybe more challenge with it? Any thoughts on that?
Sure. If you look at just general personality types, you can look at being introverted versus extroverted. You can look at people that have a strong need for communication, physical touch, all of those things, validation. And so those people that crave that type of interaction in their relationships are probably going to struggle a little bit. There is a number of people that are okay being a little more isolated. They're a little more on their own. They feel comfortable in that. And so for them, this isn't a terribly big change for them, or in some cases, a relief. I will say this, having seen a number of kids that are extremely anxious, for example, in school, this doing school online has been a godsend to them, and that they feel like, oh, I'm doing great, my anxiety is really low. And so there are a number of people that this format actually, they're probably thriving in it better than when they were in their regular activities, to be honest. So yeah, depending on the nature of who they are and what they've been dealing with, everybody's going to weather it a little bit different.
Great, good. One last question for you as far as prepared questions. Any thoughts or insights on screen time? I know with digital learning, and there's probably the opportunity for many of our young ones to be exposed to more screen time than what we typically would see. Any thoughts on that?
Yeah, to be honest, maybe this is more for parents as they're trying to figure out what is the right amount of screen time. And what I would say is have a little bit of flexibility in that most of our kids are now increasing their screen time, especially if they're one-to-one at schools or they're using a computer to do their classwork. I think of that similar as a job. If they're using it to accomplish a certain task or a task that's required, for me, that's not an entertainment type of social media or screen time. For me, those that have seen me in the past know that one of my biggest gripes is that I feel like we have children that have way too much time and way too much access to screen time. And the reality that is increasing during this time. And so one of those things I would really caution you to do is one, limit social media, and the other is video games, especially violent video games. If you look at social media right now and you count up 100 posts or whatever people tag, 90% of those are going to be related to the coronavirus. And so there's only so much capacity that you can have to hear bad news. So be careful on what your kids are having and how much time they're having it. The other part, when you look at some of the gaming that we're doing that is a little more aggressive or violent, and they're increasing that time, what I find with kids that are engaging in those types of activities, they're more likely to be irritable, desensitized. And so if all of a sudden they're at home for the next 3, 4, 5 months and you're increasing that time significantly, you're going to find the kids that are more irritable, a little more addicted to those types of things or seeking that type of stimulus. So one, I'd say be very cautious. Really would encourage no more than an hour to 2 of some of those screen times that are not school or business related. Just be really careful. There's a lot of other things to do and it doesn't involve a screen.
Great. Appreciate it. Any additional thoughts for the group?
No, I appreciate you inviting me. Just would encourage this tough time. Be patient. Have a little patience with yourself as well. And if you start to struggle, reach out to a medical professional and try to get you in the right way. I would say from the healthcare community and the mental health aspect, this has been a big change for us as well. Most are trying to get up and become better versed at telehealth. And so in that regard, reach out if you're needing that, and you should, and don't feel embarrassed about needing that support.
Great. Appreciate it. Well, good. I appreciate your comments, and we're going to transition now to Teresa Ward and Shannon Sell with Region 2. And for many of us, that may be a great resource that we may not know a whole lot about. So Shannon and Teresa, could you just tell us a little bit about what Region 2 is?
Region 2 is the part of the Behavioral Health Authority that covers behavioral health services we cover the 17 counties, kind of going from a little ways east of Lexington to Ogallala. So we have the Heartland clinics in North Platte, Lexington, McCook, and Ogallala. And out of those clinics, we do outpatient mental health, substance abuse counseling, med management. We have a med-assisted treatment program for folks struggling with opioid addiction. So any of those services, we actually already had telehealth kind of going and in place before all of this happened. So it was as painless as it could be, and all of our providers now are functioning via either telehealth or we understand that not everybody has, whether it's the internet access or equipment at home to do telehealth. So we're still doing some phone stuff with folks too. But so all of those counseling and medication services have kind of continued as they go. We do urgent outpatient appointments with folks. Within 48 hours, they can get an appointment, and that's just a quick free of charge visit where folks can just talk to a counselor and kind of talk through what might help next. So people can feel like they could do that and not necessarily make a huge commitment to any kind of service online. But, and each of our offices have support staff kind of screening the calls. So folks can just call and get an appointment just like they always did. We also have community support, which is kind of like case management for folks with severe mental illness and substance abuse issues. We have also gotten all those folks transitioned to telehealth now. So those appointments are going on, and lots of people get served that way. Again, if folks don't have access to the telehealth on their end, we do some phone stuff too. They're taking referrals. We have youth care, which kind of provides professional wraparound services for kids and families struggling with maybe more severe emotional disturbance kind of things. So
they're taking referrals. Our website has information how to connect with any of those services. And I guess if anything, folks might be able to talk to somebody sooner right now because it's all telehealth. So it doesn't even have to go through a specific location.
Great. Thanks, Teresa. And I think we have some prepared slides from Region 2. If we can have those come up on the screen, and then maybe Shannon can walk us through some of those.
Yep, thanks, Nate. I was just going to share some resources with the community that are available. The first one here is a My Strength app. We like to call it a health club for your mind. Region 2 has a license for this. It is an evidence-based program that's available online. You can either, you see the links there, just tap on the link from our website, or there's the My Strength app. It already has the community code in there. But it is an app that it will help manage depression, anxiety, stress. You can track your sleep, your diet. But right now there's some new tracks on there. One is the COVID-19 that they have on there, but they also have on there tips for parents and how to manage at home. Now for most people it is full time with their kids, and how to manage, like we were talking about before, screen time, how to manage a daily routine. But then there's a tab just specifically for parents. It's almost, we kind of like to call it also like a Pinterest for your mind. You can pin different inspirational quotes, different things that maybe help you, and you can go back and look at. It's available 24/7. You can use this in conjunction if you're already working with a mental health provider. It's available 24/7. You can have it on your home computer. You can have it on your phone. And it's free from, negative stereotypes that sometimes occur with those seeking mental health assistance. The next screen.
Hey, Shannon, while we're on the My Strength, I'll just share with the group. Last night, I logged in and created an account with the My Strength, and I answered the questions, did the survey, and I spent a little time figuring out on how to sleep better. I think as I've gone through the last 6 weeks, my sleep routine has been disrupted, and that's something that I've probably struggled with a little bit. And there's great pointers on there, and you can really get as in depth on that tool as what you want to. You can do it much as I did last night and just kind of go through some of the resources, or you can get as in depth and really get into a sleep log and journaling and take even a more scientific and long-term approach. So the tool seemed to scale well for the level of interaction you wanted to have with the tool. I thought it was a great tool.
Yeah, and then it'll even like you said, the survey, and then a few days later it might send you another survey or kind of see how you're doing, and almost like a little checkup. It's completely confidential. We don't know who's signed up for it. All we have is the number of people in our area that have signed up for it. Great.
Sorry to interrupt.
No, that's good. I'm glad you tried it out. And it has meditation also on there. That's good. Again, like you said, if you're having trouble falling asleep, just click on that meditation app. It works pretty good. This next slide here is the CDC. I'm sure everybody's familiar with them. They're updating their website frequently, so you can go on there, get any new information that you might need. DHHS has a new COVID-19 hotline number, and that's on the screen there. Another website is SAMHSA. It's Substance Abuse and Mental Health Service Association, but they have some good tips on there for social distancing, isolation right now with this quarantine going on. Next slide. Here I put on here some resources for the American Foundation for the Suicide Prevention. They do have a crisis text line. I know a lot of the kids, even adults, like to text versus calling. There's a 1-800 number there, or the crisis text line. All you have to do is text TALK to 741-741, and somebody will text you back. And then you can, have conversations with them over text. You can set up an email, or you can do it over the phone, but somebody will contact you back. Psych Hub is another website that has some information for you. Next slide. There's just a few more resources for families. The 0 to 3 is some tips for talking to younger kids. Center for Study of Traumatic Stress talks about helping those kids that are at home now and not attending school. Next slide. Nebraska Children's and Families Foundations. This one is a multiple resource page. It's probably 12 to 15 pages, I believe, of different resources. There are specific resources for parenting, for working with kids, well-being for kids. They do have living room learning also. Nebraska 4-H twice a week does kind of in-home classroom activities. There's community-specific questions and answers on there. It talks about if anybody has any questions regarding healthcare, if anybody has any questions regarding the WIC program or the SNAP program. That can all be found on that website. I believe the last one that I have here is the Partnership for Drug-Free Kids. That's also a good website. My notes here. But you can click on that, thedrugfree.org, and that's for those struggling with substance abuse. And you can go on there and they will set up a one-on-one appointment with you. It's confidential. You can set up an individual personalized plan with them. But there is a hotline there if you click that link that you can find. And that hotline's available Monday through Friday. If you still, after all these resources, can't find an answer to your question, I would suggest using that DHH number or also the Nebraska Family Helpline, and that can be found on that Nebraska Children's Foundation website.
Great. Well, thank you, Shannon. If I was to really condense that down, it sounds like Region 2 Human Services is a great aggregator of data. You guys collect information from a lot of different sources and try to make that available. So it doesn't really matter what issue an individual may be going through. Individuals can go to that website and find a lot of resources that could help them through a situation that they find themselves in.
Right, and then our website also has, like Teresa said, the services that we provide, the 17 counties that we provide for. But yeah, there's a lot of information on there, and hopefully they can find the answers to their questions. One thing, we do offer a lot of trainings regarding mental health, first aid, suicide prevention, drug and alcohol classes, but right now, due to COVID-19, those have all been postponed until a further date. But once everybody can meet again in person, we'll get those back up on the website and get those going again.
Great. And would you and Teresa have any suggestions for ways to stay connected while we're in this physical distancing phase?
You know, we've been talking to folks. One of the services we provide when groups are okay is a day rehab program that's kind of day programming for folks who maybe are struggling with some mental health symptoms. We've talked a lot to those folks about, okay, maybe the ways I stayed connected before aren't working for me now. So maybe I wasn't somebody to hop on the phone, but now I do need to make the effort to just make a short phone call or text somebody. Or I think that there are ways to use social media in healthy kinds of ways, rather, you know, not maybe stay away from the stuff that agitates me or makes me anxious, but I can find some positive resources out there too. So I think it's just a matter of reaching out a little bit. Maybe it's taking the phone calls up a notch to FaceTiming. Maybe it's just a quick text to say, hey, how are you doing? I was thinking about you. So I think just still connecting with some of those natural support people, and maybe finding ways to stay in touch with those folks that we might have just ran into downtown before. Reaching out.
Great. Appreciate it. Thank you. Anything else, Shannon or Teresa, for the group? Really appreciate it. And I think the presentation that Shannon had with the listing of those websites, Deb's going to email that around in the update. So you'll have those links in your inbox as long as you've signed up to receive the daily updates from Deb. So for anybody that hasn't, it's deb@gothenburgdelivers.com, and you can get added to the list for daily updates, and those resources will be sent out to you. Next, we have some questions for Dr. Rhodes as it would pertain to the school. So Dr. Rhodes, any general thoughts or comments from the school before before getting into any of the questions?
Well, we're kind of in a holding pattern here based on current DHMs that we are receiving. So we continue to provide educational services virtually. We provide school lunches on a daily basis. We are preparing about 4,000 meals every week for our kids. Our last student day has been set. It is March 15th. The last day for seniors will be March 6th. And I would just mention this, you know, one of the great things about the community of Gothenburg is our philosophy is all means all. And one of the things that school folks do and do very well is to monitor and assess the well-being of our students. And that can be kind of difficult in the virtual world. So I would just remind our community members that state law does require any individual within a community that if that individual has reason to believe or suspects that there may be child abuse or neglect going on, that that be reported to the Child Abuse and Neglect Hotline. I have given that 1-800 number to Deb as well as the DHHS website. Again, as a community, we've got to look out for our kids and each other. And if I would just say as a community, if you suspect something within your neighborhood as it relates to child abuse and neglect, please report that. It is your contact remains anonymous during that call, and you remain anonymous in the case of an investigation that could be done by a family service investigator.
Great, thank you. A question that we have had a few different times is the topic of graduation. I know I've got a senior at home, and I guess I'm excited to hear the answer for, are we going to have a graduation?
Yeah, we just received another guidance from Commissioner Bloomstead about 45 minutes ago, actually. And we are going to have a graduation. There is no question about it. Currently, we surveyed or are surveying our seniors to get some direction on what they would like to see happen. Right now, any graduation that would take place to be in compliance with the most recent DHM would have to be virtual. And so, you know, we are visiting with our seniors about within these guidelines, do they want that virtual experience, or do they want to kind of wait this out to see if some of those restrictions are lifted? And so based on the results that we see from our seniors, we'll make that decision. My thought at this point is that we will set a date for graduation. Most likely it will be a late July to early August date. And the type of graduation will certainly be dictated by what we're hearing from our health officials and from the Department of Education.
Great, good. I'm going to jump back up to some questions for Dr. Dalrymple. Dr. Dalrymple, if you're on with us still. Question came in. I have a loved one that works in the healthcare industry. How can I best support them? I think that's a great question.
So I think that's a very nice question. I agree. I think that one thing you can do, you know, we need masks. So for the community to help take the pressure off our masks that we use at the hospital. So making masks if you have the ability to do that. The other thing, you know, take these precautions that you should be taking anyway, that we've talked about, and making sure that you're trying to stay as safe as you can. And if you're coming into the hospital, you know, that you're trying to keep us safe as well. And if you're, particularly if you're talking about somebody who works in an area who's really busy taking care of patients right now, like in a hotspot area or something like that, you can always reach out to them and see if there's anything that they would need help with that you can safely do. I know there's a lot of people who are, not going home to be with their families because they don't want to expose them. So I think just helping in that sense is good too.
Yeah, and I think in the spirit of looking for the positives, that's something that this group has certainly talked about in the past, trying to understand the sacrifices people are making to give gifts to other people. It's the gift of wearing a mask to protect other people. It's people not going home at night to see it, to spend time with their family because they're healthcare professionals and they're don't want to expose other people and don't want to be exposed themselves. It really is an act of generosity, and just I think trying to put yourselves in the shoes of what it would be like to be a healthcare provider and acknowledging the effort, I think certainly go a long ways. Yeah, thank you. Had a question for Katie with Two Rivers. The question for Katie was, what is Two Rivers doing with testing? Who's administering the tests? Is that a test that's done locally? Does that get outsourced somewhere? Can you share with us a little bit of information about the testing procedure?
Yes. So we prefer for doctors, and I'm sure doctors also prefer for themselves to administer the test and make the decision when the test is completed. We are working with the Nebraska Public Health Lab, the Nebraska National Guard, and DHHS to get test kits to individual or entities within our community, hospitals, clinics, those sorts of people. We do have a couple of those Abbott lab test machinery. They're in our district, but we weren't really part of the allotment process for that. So we are working on getting more. The more that we have, the faster we can process test results. But we're doing as much as we can to get as many people tested as we can.
Great. Perfect. Thank you. And I know we're running close on time, and we did not make it to the entire list of questions. But real quickly from Colton, if Colton's on with us, if he could share with us just a little bit about the food pantry and some of the volunteerism opportunities, and then even stimulus. And with it, it's my understanding the Early Childhood Coalition is putting together an educational opportunity.
Sure. Thanks, Nate. And I'll be brief since we're hitting an hour here. I thought I almost got out of this, but the Early Childhood Coalition, we focus more on more than just early childhood. We actually have some funding in part to support Nicole Hetz's position here in the community to really focus on community well-being. So one of the things that we're doing is in concert with Flatwater Bank, we're going to be holding a virtual personal finance class. Look, we're all getting, or many of us are getting stimulus payments either through the SBA program or through the IRS. And so we may not be feeling this all right now, but I think we all have uncertainty on what things are going to look like in the future. So we're going to offer this class hopefully as a way to reduce a little bit of stress associated with that uncertainty. The second piece is Nicole is a great resource to help coordinate needs. We actually did get some additional funding from Nebraska Children and Families Foundation to help with our high-level needs here in the community. So if you have a need, or if you know somebody who has a need, please reach out to Nicole Hetz. You can get in touch with her at geclc.coordinator@gmail.com or go to our website at geclc.org. Again, Nicole, that's her job, is to help coordinate community well-being here in Gothenburg. The final piece I'll leave it with is we did get some word back from the food pantry at Gothenburg First United Methodist Church. We're told right now they're fairly well stocked, but they expect to see that stock to go down pretty drastically here. So they're always accepting donations, spaghetti, mac and cheese, soups, canned fruit, canned chicken, stuff like that are their high need items. They do have some toilet paper if people have a desperate need for that. And then, of course, monetary gifts. If you can help them out with that piece, I know they had to purchase a refrigerator recently, and that's obviously important for storing these goods. So, again, if you can help out in any way, please reach out to Pastor Jamie over at the Methodist Church, or like I said, reach out to Nicole Hetz with the Early Childhood Coalition.
Great. Thank you, Colton. And thank you to everyone who submitted questions. I apologize we were not able to get all the way through the list of questions. Again, a special thank you to Katie Mulligan for helping us out from Twin Rivers. Special thank you to Dr. McConnell. Thank you to Teresa Ward and Shannon Sell. Really appreciate you guys' participation. Last week we ended with Taylor Burge, a 13-year-old girl, reading us a pseudo Dr. Seuss poem. And that was a really positive and uplifting way for me to end that meeting. Just a few seconds ago, I texted Senator Matt Williams. I saw he was on the call with us, and put him on the spot to try to live up to the uplifting message that we received a week ago. So Senator Williams, you're on.
Well, thank you, Nate. I've been called a lot of things, and Dr. Seuss is not one of them. But I certainly enjoy him, and I think we all need to lighten up with some of our thoughts and attitudes right now. Last week, I quickly talked about stepping up, and I will tell you, I have 19 communities in my legislative district. Gothenburg is the only one that I have seen with doing what we're doing with virtual community meetings on a weekly basis and communicating at this level. And that is truly stepping up. We saw our churches this last week with Holy Week followed with Easter, stepping up and doing church in a totally different manner than they are used to and that we are used to, and they stepped up. We've seen here on the call today what our school is doing, what our hospital and our medical providers are doing. Also, Colton mentioned the stimulus. The Paycheck Protection Program has been a huge success. The federal stimulus was $349 billion, and as of this morning, all of that money has been allocated, and we're hoping to go back to Congress and get more. In Nebraska, there's been in excess of 18,000 businesses apply for those loans in an amount of in excess of $2.7 billion. That's going to make a significant difference. I think what we need, the ultimate question that you asked, Nate, from the very beginning of our talk today is, when are we going to be back open? When is it going to be business as usual? When is business ever going to be normal, or are we going to be looking at a new normal? And I think the word that I would throw out there for all of us is patience. Yesterday, it was announced that a mall in eastern Nebraska is potentially going to open or try to open next week. When that was announced, there was a huge gasp, I think, from the medical community, from the state and local government that is out there thinking, why, when we have worked so hard to come so far with trying to flatten the curve, would we just rush towards opening something like that? And I think we need to think about that when we're thinking about where we're going to go in the future as a community. It's not going to be switching a light back on. It's going to be a gradual rollout, as the governor has talked about, as the president has talked about. And we need to think about that locally also. But right now, it is still in our best interest to follow the guidelines that Dr. Dalrymple talked about, the social distancing, the personal hygiene, the limiting groups, the shopping once a week, wearing a mask, even though it feels funny to do those things, and be patient. Patience is not the ability to wait. It's the ability to keep a good attitude while waiting. And I think that's what each one of us can be the example, continue to communicate, continue to support those people, our kids, that need our help and support. So I continue to look forward to these weekly gatherings, and I think we as a community have a great deal to be thankful for and a great deal to be proud of. So thank you all.
Absolutely. And thank you, Gothenburg, for taking the time to participate. I do want to try to destigmatize this. Dr. Dalrymple, in the sense of a quick application, I'm not sure I followed all of your guidelines, but please be leaders. Continue to be Gothenburg. Thank you, everyone.